Hi, welcome to Ask Giri the Physio Show, Season 3, Episode 3. Today, we're going to talk about shoulders, shoulder injuries, shoulder rehab, especially to the athletic population. What are the 7 key principles in rehabilitating a shoulder in athletic population? So, that is the main concept today. So, what are the physiotherapy aims when you have a shoulder injury? We have to make sure that we put the patient back to the sports and rehabilitate them in really good way. Put the person or athlete back and improve their sports specific biomechanics and technique. That's very important aim for physiotherapists. Depends on whatever sports the athlete is involved in. And to increase the intensity of the rehabilitation program to challenge them so that they are better at performing in their sports. And to build resilience for all kind of load the body or the tendon has to take, and involve the physician, the family, the coach, physiotherapist, an athletic trainer, personal trainer, everybody, the multidisciplinary team approach. So these are things we involved in as physiotherapists to put the athlete back into their sport. So 7 key principles, where this come from? This is just released by after this 2022 Bern consensus about like bunch of scholars, bunch of experts got together and decided what works well to treat athletic shoulder injury, what didn't work well, what the research is saying, what is the evidence. So they sat down and came up with these 7 key principles. This beautiful article published in Journal of Orthopedic and Sport Physical Therapy recently, about maybe a couple of weeks back. So it's about 30-40 pages of document, reviewed everything, and I thought, you know what, I should share this information to my audience so that they understand what are the key principles they have to focus on in rehabilitating the injured shoulder. Let's move on quickly. The key principle 1. Let irritability guide the rehabilitation program or progression. So it doesn't matter what type of injury, what type of surgery they had, or what type of stage they are in the rehab process, stage 1 or stage 2 or stage 3. Irritability of the tissue, it's very important factor. So that means you have to respect the pain. It's not like no pain, no gain here, okay? So how pain you have to respect and modify the exercise program based on that. And how much of weakness patient has, modify program based on that. And is the patient able to sleep in the night? Are you able to do basic functional activities? These things we have to take into account. And that's very important thing they're talking about as a key principle, number 1. Number 2, address very clinically relevant shoulder active range of motion deficits using active exercise. Okay, that's very important because the range of motion deficits are common even in normal population, right? For the people who are doing our overhead sports or throwing athletes, we'll have excessive external rotation, we'll have limited internal rotation. There are terms for it. ERG, they call it external rotation gain. They might have more external rotation. And there's another term called GIRD, G-I-R-D, glenohumeral internal rotation deficit. These are the terms derived to kind of cause it as an abnormality, which is actually not. Normal people, normal athletes with overhead sports can have an external rotation gain, can have an internal rotation deficit. So we don't have to worry too much about it, but you have to treat it as you see it. Work on the active range of motion first and don't worry about these deficits. Deficits are normal in normal population in athletes. So scapula is another one that's a key principle 3, right? We do have to address scapula in the rehab, but we don't have to dwell too much into the dyskinesias. I have seen, because I do take students in the clinic, and in this presentation, one of my students is going to help me as a model to show some of the exercises. I am a clinical instructor for 3 universities, of course, University of Alberta, then Brunel University in London, and European School of Physiotherapy in Amsterdam. So we have a student from Amsterdam here. She's going to help me with exercises. They do ask me quite a bit of questions about scapular positions, dyskinesia, how much scapula is moving or rotating when the patient is moving. Yes, we have to take into account few things, few abnormalities, but we don't have to dwell too much into the dyskinesias, pay too much attention there. That is what the key principle of number 3 is saying here. So it's of no value, they're saying. Like you don't want to focus too much on that because normally dyskinesia is present in 53% of the healthy people and 61% of overweight athletes. So just a key point to take home. Now the key principle 4. Select the appropriate exercise. That's where the role of physiotherapist comes in with the help of his team, kinesiologist, athletic trainer, and personal trainers. Selecting the appropriate exercises. Exercise is like medicine. You have to have a proper dosage, proper prescription. Otherwise, it can go wrong, right? Open kinematic chain versus closed kinematic chain exercises when it is appropriate, right? That's very important. For example, if the patient have anterior instability of the shoulder, you start with a lot of closed kinematic chain exercises and you progress. And the other spectrum, if somebody has acromioclavicular joint pain, you do a little bit of open kinematic chain exercises, not a lot of closed kinematic chain exercises. Just a simple example on that. So like that, you have to choose what's the right exercise for your athlete. Again, it depends on your specific injury and also the phase of rehabilitation you're in, right? And also on the end stage of exercises, when you're almost stage 3, when you're returning to sport, it has to be sport-specific exercises. We're going to show some sample exercises here for what we do for these kind of things, okay? Let's go into the demo. Hey guys, I'm going to introduce Sunny. Sunny is a PT intern. Is doing an internship, final internship with us at Institute of Physical Therapy. And Sunny.
I'm Sunny, like Giri said. I'm a final year physio student from the University of Amsterdam. I'm really happy to do my internship here and happy to meet a lot of people and help a lot of people. That's why I wanted to do physio in the first place.
Awesome. So Sunny is going to be my model today. We're going to talk about open chain and the closed chain exercises, what we normally do for the shoulder and also prescribed by the 2022 Berne consensus statement as well. So we're going to do open chain with band first, opposite knee, right?
Yep.
And then go back, rotation, yeah. Nice breathing. So you watch that, it's kind of a PNF pattern as well. You're starting with the lunge, you're starting with a little bit of adduction, then you're going into the abduction, scaption and external rotation. It's like you're covering multiple movements in one. Nice breathing with it. This is a very nice open chain exercise. Okay. Great. Okay, thank you. Now we'll see one closed chain exercise. Shall we do the push-up and walk back thing?
Yeah.
Okay, let's go into the push-up position. So this exercise, basically you're gonna start like a push-up position like this, and then you're gonna walk back, keeping the arm in the same space and walk back with the legs. Yeah, keep walking back, keep walking back. Yeah, and then come back again. And you're not moving your arms. It's a wonderful dynamic stability closed chain exercise for the shoulder. One more time. Yeah, walk back, nice breathing. Good. It's hard, isn't it?
Yeah.
Come back, walk back in. Yeah, awesome, great. Thanks, Sunny. So these are the one sample exercise for open and closed chain exercise. Okay, I hope you guys enjoyed those demo exercises. Now we're gonna go to the key principle 5. Include plyometrics early in the rehabilitation program, because we already talked about in previous episode how diverse you can be with shoulder rehab with exercises. Plyometrics is a big part because plyometrics is a part of most of the sporting activities. You need that, right? And very safe performance of plyometrics have to start early in the rehabilitation phase to increase the proprioception, the strength requirements, and also progressing to the high velocity and functional programs. That's very important. And we're going to see some sample exercises for plyometrics. We basically use a small 2-pound medicine ball to do that. You can also use the baseball if you want. You don't need to have a heavy balls because you have to be able to grab it. We're going to show some demo on the plyometrics here. Okay, now we're going to show you some simple plyometric exercises for the shoulder. So, Sunny, can we start with abduction and then drop and catch? Yeah, that's about a 2-pound medicine ball. This is a great exercise to start with. Again, depends on the injury and the stage and also the pain level and irritability of the athlete. It's not like no pain, no gain. We have to respect pain. How does that feel?
Hard.
Hard, isn't
Yeah.
it? It looks very simple. You should try this. It's fun. Okay, now let's try the external rotation.
Okay.
Yeah, drop and catch. Yeah, try this. Good. That's good there. Take a break. So this is a exercise, a plyometric exercise number 2. The first one we did with full abduction, second one we did with the external rotation. Now we're gonna try with external rotation, throw, catch, right? Let's try that. Great, awesome. These are the sample plyometric exercises you can work with your athlete. It depends again on the stage of the injury and the pain level, okay? Train the brain. We all know that any injury in the body results in cortical changes. There's a lot of proof for that, and there's a lot of evidence for that. So that cortical changes can inhibit your muscle action, and also influenced by so many factors like your previous experience, previous injuries, fear of movement especially. We call that kinesiophobia, right? So these are the things can happen. So in these times, we have to use some special techniques to treat the brain, okay? I've attended some courses with Butler and with a Noi group, so about graded motor imagery and techniques, and also we have mirror therapy. We use lots in orthopedic as well, not only in the stroke rehab. We do mirror therapy in the clinic. We using a lot of graded motor imagery techniques. What is graded motor imagery techniques? Like example, say I will tell the patient with a shoulder injury patient, I would tell them, okay, watch something in the TV where somebody is playing volleyball, right? Watch how they are moving their shoulder, watch how they are hitting the ball, right? And how they are jumping and landing, and how they are using the shoulder. Just watching someone using the shoulders in a very optimal way, and also in the sports activity, is going to stimulate your mirror neurons. Okay, mirror neurons are another topic to discuss later. Just watching that will improve your shoulder condition, right? And also other graded motor imagery techniques, like you're just sitting in a calm place, closing your eyes, just seeing you doing some activity with your shoulders. For example, just watching yourself boxing, right? And you're sweating, you're happy, you're enjoying it. That kind of going through those scenes in your mind and using your shoulders, or lifting and throwing your kid and catching them, or playing dodgeball with your kids or with your friends. Those kind of activities, when you see that, that creates a positive impact in your brain, and it removes the inhibition a little bit. It helps you in the rehab. There's a lot of evidence for that, okay? Then, these cortical enhancements, it's very important for you to have a focused attention of what your sport you're going to, what the problem you're dealing with, right? And also, if this shoulder is injured, using a lot of bilateral movements can also help with to kind of doing that cortical enhancement in your brain, and it will help you to alleviate the pain and increase the movement. So make sure that when you have shoulder injury, you train the brain also a bit. Key principle number 7, this is the last principle. So here we are talking about, if you're returning an athlete to the sport, obviously you have to do a sport specific exercise based on what it is. For me, example, I play cricket in the league, and I am a bowler, like, I bowl, I run up and I bowl like that, right? So I'm kind of consider myself as a partially overhead athlete. And some of the shots you hit in the cricket with the bat, you got to do like a kind of a shots like that. We call the hook shot. We got to move your shoulder above head as well. So I do get some shoulder pain as well. So I do some sports specific exercise so that I can be a good bowler and a batsman. And also there are throwing in cricket too. We got to take the ball and throw from the deep. So I do get some pain in my shoulder. So I do some very sports specific exercises, which I'm going to show you some demo. What are the things I do and what are the things this 2022 consensus has recommended as well. So we'll go through the demo, then you understand. So this is very important phase. In the last phase, we have to train the athlete in the sports specific performance. Okay, let's go see some sample exercises on this sports specific exercise.
Yeah.
So demo for the sports specific exercise, we're gonna do, Sunny gonna do a clap push-up first. Let's try that. In the later stages, we can try it, yeah. Great. Great, thank you. I don't want to make you tired. Sunny already mentioned that you need to work on her upper body a little bit. It's a hard one to do so you guys can try this for the later stages of the sports rehab. And also we're going to use a Y balance kit for the dynamic shoulder activity. We use that quite a bit because we are FMS certified physiotherapists in the clinic here. We do the functional movement screen and Y balance quite a bit. So we're going to try that on the Y balance beam for the shoulder dynamic stability sports specific exercise here. Let's go in there. Yeah, keep it there. Yeah, toes down, nice. Yeah, you can move that nice and slow, good breathing. Good, come back. Slow it down a little bit more. Now let's go, yeah. Nice. Then the other side. Go, 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 go. Come back. Beautiful. Now the same hand goes here and then move it this way. Keep coming, keep coming, keep coming, keep coming. Nice rotations and go back. Awesome. Kneel down and take a break. How does it feel?
Hard.
Hard, isn't it?
Yeah, but
Yeah.
good.
This is just one rep. We'll do multiple reps based on the athlete's the stage of recovery and also his performance and what sport he's returning to. These are sample examples for sport-specific exercise. I hope you enjoyed it. Hope you guys enjoyed the demo. Hope you guys enjoyed this presentation. Short and sweet, 7 key principles. If you're an athlete, if you're injured with your shoulder, remember these 7 key principles. If you're a physiotherapist treating the shoulder injury patients, athletes putting back to the sports, remember these 7 key principles. Thank you for watching this presentation, and I will see you again this month with another awesome episode. If you like this, please share it with your friends and family and subscribe to my YouTube channel, Ask Giri the Physio Show. Also, do not forget to watch the archived episodes in physioshow.ca. Bye.